Florida have been diagnosed with COVID-19. Many of those cases just recently confirmed, and we have seen a very concerning spike. Let's get to Dr. Jason Wilson from Tampa General Hospital. Joins us live this morning to talk to us about where things are and where we go from here. Doctor, good morning.
Hey, good morning. Thanks for having me.
Thanks for being here. So, well, first of all, let's find out how you guys are doing over at TGH. How's it looking over there for you guys?
Well, we were very prepared for this. We had a number of months to sort of ramp up operations, to form interdisciplinary teams, to create spaces that are safe for both patients who have COVID and who don't have COVID. So we're rolling. We're definitely in the thick of it right now, but it's still a safe space at Tampa General.
What was your reaction yesterday when that number came through, 15,300 new cases? What did you think when you saw it? Does that surprise you, or were you expecting it?
Well, given what we're seeing clinically right now, it's not a surprise. Okay. If you put ourselves in the shoes of us a month ago, these were numbers we wouldn't have imagined having here at that point in time. We really had a much different perspective or different look of things a month ago than where we're at right now. But every week we're seeing escalation of the number of people who are presenting with COVID. We're seeing different types of people now with COVID. First we saw this big spike in young patients. Then we sort of saw what we knew would come after that a couple of weeks later, sicker, older folks. Mm-hmm. And now we're really seeing a lot of patients. It's almost surprising patients don't have COVID in this area right now. So much COVID is out there.
One of the things that we're hearing is that maybe, despite the fact that there's a spike in cases, fewer people are dying. Do you have an explanation for that? Do you even agree with that?
Well, there's a couple of things that are important to talk about with this. First of all, I hope that's true, right? I certainly hope that it's true that as things have gone on, that less people are dying. And look, it's almost a truism that any virus, that as it goes through the population, over time it will evolve and the weaker strain of the virus will be there. Having said that, though, we're still in a place where we expect that the counts of people who die will lag behind the spike in the number of cases. Mm-hmm. We've seen that every single place where we've seen spikes is that a few weeks later, the spike in the death count starts to happen as well. So I hope we don't see that. That's what we're trying to prevent. We've certainly gotten better at treating COVID as well. We've learned things about resource utilization and how to help patients oxygenate their lungs better. And some of the medications we're using in the hospital setting are certainly better than they were 2 months ago.
Hey, we got to go, but I want to let you say it. What's the best thing I can do? What's the best thing we can do to protect ourselves?
This is super important. It's really a time for the public to help us, and you really can't help us by wearing a mask, social distancing, staying away from crowded indoor spaces.
Okay. Wanted to hear the doctor say it, not just me. Good luck. Take care of yourselves.
Thank you.
And we're glad you're there. Thank you for all you're doing.
Appreciate you having me. Thank you.
Bye-bye. Hey, Dave, what's going on?
Hey, Russell, I've been harping over the past few hours on the lack of rain.